During this pandemic, what do you do if you're not feeling well? Can you still go to the urgent care? And how can you access telemedicine with doctors to determine what kind of care you need? Dr. Michael Posner is the Chief Medical Officer for Starling Physicians. He's here to answer those questions and more. Thank you, Doctor, for being here.
So the short answer is yes, you can avail yourselves of us. We're open for the community to be helpful. We're doing that in a couple of different ways. We're doing a lot of telehealth, and that's certainly a safe way to access your physician or advice from home without having to risk any sort of exposure. We also are open for things that require to be done in person, such as sick visits in certain locations and other things that really can't adequately be done from home. So we're trying to be as open as possible through all these different modalities and take care of patients while this is going on around us.
Are most of the calls you're getting COVID related, people concerned if they need a test or evaluation, or are they other things?
It's a mix of both. We set up a COVID hotline, so certainly that's going to field all of those calls. And obviously the majority of those will be for COVID-related concerns, people who are acutely ill or just have questions or concerns about how to keep from getting ill. And then the regular provider lines, we're getting a lot of questions just as we would routinely about people's medical health and trying to answer those either over the phone or set up telehealth visits for those.
What about typical things you would see this time of year? I'm thinking, kids still get sick and they're all home and homeschooling, but kids still get sick. We still need to know if someone needs an antibiotic. Is there anything really going around in the community that you're having to treat right now?
Certainly, you hope that with all the quarantining, it's cut down at least somewhat on all of the non-COVID infectious diseases. But yeah, you're absolutely right. There are certainly still routine things that happen in any circumstances, and we're certainly hearing those questions also.
So a lot of people might wonder, how would telemedicine work? Like, what if someone's watching right now and they do have an issue and they're thinking, I don't want to go to the ER, I don't want to be exposed. What's step one to get in touch with a physician and see what you might need?
So assuming that you're an existing patient, you just call your regular provider. They'll set you up either, if it's just an answer it. If you need to be set up with a telehealth visit, we make it pretty easy using a platform that allows us to just send you a link, and you can click that on any smart device and it goes to a virtual waiting room, and then you see your doctor as you would if you were in the office. It's pretty neat. We're all getting used to it a little bit because although we were in pro telehealth before this has certainly accelerated the move to it. And I think we're all learning about that many more things are appropriate to it than we probably thought before. But it is pretty easy from a technology standpoint. You just click on a link and there you are.
My mom actually kept her appointment with her gastroenterologist. She thought it would be canceled, and she didn't have high hopes. As a woman in her 70s, she thought, how is this going to work? But she was surprised that even through Zoom, they were able to determine what she needed and call in a prescription and actually treat. Do you feel as a doctor that you can still do your work well when you can't touch or feel someone?
Obviously, it has limitations in certain circumstances, but it's vastly more appropriate probably than we would have thought if you'd asked us all this question 2 years ago. And we just work within the limitations, but you can really get a lot of the work done even without direct hands-on physical exam. And you can still visualize things. The patient can show you things. They can move things themselves. So really a surprising number of complaints and problems do become appropriate for it. So that's been good.
Should you keep your well visits? What if you have a physical coming up, or your child, you have a baby and they have, frequent well visits? Should you still go to those?
So the American Academy of Pediatrics, I'll address children first, has issued guidelines for which well visits should still be kept because of vaccinations and things like that. So call the pediatricians if you have any questions. They're also cohorting so that you're not going to, if you are coming for an in-person visit, you won't be in the same waiting room, ideally with someone who's there for a sick visit, which many of them do even in the absence of COVID going on. And then, for adults, if it's a completely routine yearly physical, we're going to put it off. And you would have already been contacted by us or will be. On the other hand, there's what are called annual wellness visits, for example, for Medicare patients, and those can be done virtually, and you can get the same benefit out of them because for a visit like that, the physical exam, although it has some useful components, is really less important than going over medications and your chronic medical problems and making sure that you don't fall behind on those and wind up getting sick or in an emergency room.
A lot of people have asked me, though, but what about the first thing you go in and they want to weigh you, they want to take your blood pressure, listen to your heart? What do you do about things like that?
A lot of patients can take their own blood pressure and their height and weight at home. That's always better than not having the information at all. That said, if we can't get some of the information that day, we can still go over everything else in the visit that we would have. And so maybe it's not 100% what in person would have been, but certainly doing it from the safety of your home, given the pandemic, is a very reasonable alternative.
Yeah.
One imagines in the future, there'll probably be more devices people have at home to facilitate even things like heart and lung exams in the future. I look forward to that.
Yeah, so interesting to see what parts of this telehealth will stay. A lot of people are concerned about safety. How have your safety measures changed at your offices for your urgent care facilities?
We were pretty quick to adopt patient screening at the door for temperature and symptoms. We have what's called Freesia, which is a check-in process that you can do online or on your phone before your visit, and that has screening questions. So that's been helpful as well. We also began probably 2 weeks ago now checking not just the patients, but the staff and the physicians for fevers and other things to screen ourselves at the door so that we make sure that we're giving you a safe environment. We're avoiding people waiting in waiting rooms. People can wait in their car if they have to come in person, and we call them in when we're ready. We, of course, always cleaned our office as well, but there's even extra attention to wiping surfaces down. The providers who see you, anyone in direct patient care, has been wearing a mask at all the Starling facilities for about 10 days. So we're doing everything on the checklist we can to make sure that we're keeping social distancing. And when we are closer than that, everyone has a reasonable amount of protection from things like masks.
Yeah, how is your PPE situation? We keep hearing in the news that's a big problem for doctors.
It's a concern. In the office setting, we don't need the specialized masks called N95s as much as they do in hospitals. We reserve those for higher risk interactions. Surgical masks, although we have concerns in the medium to long term about supply, so far so good, although we've had to go to outside our usual supply chain to find them sometimes.
And when you have, if someone at home is a new patient, what would you recommend? Is that okay? Are you taking new patients? Can they call Starling Physicians and get an urgent care appointment for perhaps something that has no relation to COVID?
Absolutely. We have multiple providers and virtually all the specialists who are taking new patients. We'll do the same triaging when we speak to you, figure out if it's something that can be handled over the phone. If it can't and it's an urgent visit, then we'll figure out a way to see you. And as I mentioned a minute ago, we'll do it as safely as possible.
I was reading in your background that, I think if any of us had those symptoms of shortness of breath or a viral infection, there can be a certain amount of panic. But you say patients with mild viral syndrome don't actually need to be checked for coronavirus off the bat?
Correct. And that's for a couple of reasons. Some of them are just pragmatic. There's still a limited amount of testing supplies available in the state. So although we would love the luxury to be able to test absolutely everybody in sight and get a picture of exactly what's going on in the community, we don't have those supplies. So we have to reserve them for people where the decision about whether or not that patient has it, for example, if they're a healthcare worker, you need to keep them home so they don't expose other people. So that said, although certainly not all cases of this virus are reasonably mild and can be treated at home. So in that case, if you have mild viral symptoms, even if they're consistent with COVID and you're not particularly sick, you're not short of breath, really staying at home is what the treatment is going to be recommended anyway, even if your test were to come back positive. The trick is that you need, to the extent possible, to be quarantining yourself from the rest of the people in your household so that hopefully if you do have it, you're the only case in your house.
Right, and that becomes a little bit tough if you are living with people. But let me just get this out there that I know that some people have seen their symptoms go from mild to severe kind of rapidly. What would you advise people watch out for? When do they need to know they really do need to be seen?
The biggest thing is going to be shortness of breath. I think you should have a lower threshold to be calling for help, at least getting advice from whoever your provider is, us or someone else. If you have multiple medical problems, in addition to maybe symptoms that are slightly milder. If you have someone who's young and healthy, with no shortness of breath, maybe they're febrile, they feel lousy, they have a cough, it's fine to monitor, track your fever curve, call for advice if you need it. But I can tell you that if you show up in the emergency room with those symptoms, they're going to take a look at you, figure out that you're okay, and send you home.
Okay.
So again, why make that trip if it's not likely to lead to a change in treatment? If there's a concern that you may need to be admitted to the hospital, then by all means, you need to be either on the phone with a provider or in an emergency room. But that's going to be reserved to people who either have other risk factors and most likely are short of breath.
Okay, and just to review, you're seeing that this can happen 2 to 14 days after exposure. The typical symptoms would be fever, cough, shortness of breath. They'll talk about some of these other newer symptoms that are being added to the list, like a loss of smell and taste, and also GI problems.
Correct. It's always hard to know for sure how much to trust a given statistic because we're early in the process, but I've seen recently that about 20% of people maybe have GI symptoms. I don't know a percent for the loss of smell and taste, but that one has been talked about a lot and maybe reasonably common, so it's something to be on the lookout for as well.
Now, what about...
And then also kind of your basic runny nose, headache, sore throat, and are not necessarily the majority of cases, but it can certainly manifest.
Okay. Yeah, and a lot of the new advice is that if you're going to a public place, we need to be wearing a mask. Is that what you're advising everyone to do?
Yeah, it's certainly ideal. I think that they were hesitant at first because the last thing you want to do is make a shortage of masks in the healthcare setting even worse by having everybody competing for them. That said, each slight barrier for everyone when you're out in public is going to have some degree of avoidance of droplets getting on your face and your eyes. It'll also keep you from touching your nose and your mouth and your eyes, which that in and of itself is probably useful. So yeah, I think it's definitely good advice. And it doesn't have to be a surgical mask. It certainly doesn't have to be one of the higher, N95 particulate masks.
Right.
Any sort of fabric, and you can read different recommendations about which ones are best. But I think it's a great idea if you're out at the grocery store or any kind of public place.
Yeah, people are getting very creative. You can make them very easily with just pieces of fabric, even T-shirts.
Sure.
So this is something more if you're just going to the grocery store. People don't have to take those masks that we know the doctors need. Do you need to, let's say you are using a bandana, or we had a friend make some fabric Channel 3 masks for us here. What's the care for that? Do we need to be washing those every time you use them?
So here's the trick with that. What you don't want to do is protect yourself in an efficient fashion, and then when you take it off, you contaminate your hands, and then you touch your face.
Yeah.
So that's a great question. You need to preferably take it off without touching the front of it that may or may not be contaminated. And if you have the luxury of washing it before the next use, that would be ideal. Otherwise, you could hang it somewhere. And again, when you put it back on, be careful how you touch it. Wash your hands before and after touching any part of the mask that might have become contaminated.
So I want to encourage the folks who are joining the feed. We do have several of you joining us right now, about 1,000 people here listening, Doctor. So I want to just, those who have gotten on now, I know a lot of people have individual questions because I get them on my Facebook page all the time. So this is your chance. If you have a question for the doctor that's specific regarding if you can get treatment or something that you're wondering about your life in the pandemic right now, we are speaking now with Starling Physicians, and we're here with Dr. Michael Posner. He is the Chief Medical Officer. So thank you for being with us. Just to recap, your urgent care centers are open, but you're not accepting walk-ins. There's a different procedure if perhaps you think you need an urgent care for something.
Exactly. We have our regular providers who are seeing urgent patients, but there's a process that one has to go through, and that's for everyone's safety to make sure that we don't have patients who may have coronavirus in the office without realizing it and having appropriate protections, such as masking the patient and some other steps that we're taking to protect everyone.
And someone's asking about the GI issues. This came up for someone I know as well, too, that we didn't hear about this from China, but now doctors are realizing that a symptom could be a GI issue, and they're asking what type of GI issues. It can be confusing because a lot of people have IBS or issues that always affect their stomach.
Correct. And certainly anxiety surrounding fears of being sick can worsen a lot of those things or just give people GI upset to start with. But diarrhea is the one that I've heard the most frequently. Okay. And it's not a majority of patients, but it's definitely a significant minority.
All right, so it's mostly if you're that would be something to mention to your healthcare provider, or if you call the hotline that you're having either diarrhea or abdominal cramping or something that wouldn't just be a light tummy ache.
Correct. And sometimes it can be hard to tell. But if you have any questions, certainly ask about it. But yeah, abdominal pain and diarrhea are the common ones that we're hearing.
So I want to give everyone the hotline because Starling does have a hotline now. It's 860-368-2271. And I understand patients can call up and talk to a nurse. And sometimes that's all we need is just to have a nurse tell us, no, you're fine. Take 2 Advil and call me tomorrow.
Correct. We're happy to do that when appropriate.
Okay. What are some of the other issues that you're seeing right now, non-COVID related? What would be some of the people that you're having to treat most right now?
We have a lot of different specialties, so that's a hard question to answer with a straightforward answer. But things running the gamut to just regular illnesses, people with chronic medical problems. We still have all those usual spectrum of things either in the office or by telehealth.
So I'm getting some questions from the feed. I just want to ask you, and this has come up a lot with the different doctors we've been interviewing. But once you have had the virus, do you have a chance of getting it again? And I know that we don't have firm data on this, but what's your best information?
That's a hard question to answer. Certainly most other infectious diseases that are similar that we know of, getting infected with it and recovering at least gives you temporary immunity. They're still assuming that with this, although it's not proven. There were some case reports that I had read about out of mostly China where they thought maybe people got it again, but they were also questioning whether the original diagnosis was accurate. So that's very difficult to answer. And also over time, some of these viruses do mutate. So the question is whether they change enough that your last exposure doesn't still protect you. We certainly hope it does, because that would obviously make it a lot easier to plan what's going to happen in the future. And we also hope that when we get vaccines for it, it'll be a long-lasting vaccine that would give you immunity, for long periods of time.
Yes, and thank you, Dr. Posner. That's definitely in line with, we were just interviewing an epidemiologist this week who is sort of on the front lines of this and saying that, they're not positive, but at this point they are assuming and hoping that it does behave like most flu viruses, that once you have the antibodies, the likelihood of you getting it again would certainly be slim. And even now doing these experimental testings of could we start using people who have antibodies and maybe taking their plasma and using that as a therapy. I know that's something down the line, but just adding to that from a recent interview that we did. A lot of folks, you're a doctor, so you probably have some advice about this. People are wondering about the masks and how you clean them. As I'm being asked, can you spray them with Lysol or an antibacterial? Could you put them in the microwave? How do you clean the masks?
Probably the washing machine or even hand washing with warm water and soap is going to be the way to go for a couple of reasons. And this has come up as healthcare entities have started to look at ways to lengthen the use of our masks and recycle them. So I would first, let me say Lysol is probably not a great idea because it'll certainly kill the virus, but then you don't want to be breathing in Lysol fumes, I would imagine, after that, especially if you have asthma or any lung disease. So I'd be careful getting chemicals on a mask that you're going to have that close to your face and be breathing through. Soap is a great disinfectant. Everyone forgets that. And it's probably not unreasonable to use some of the alcohol-based things with the understanding that, especially with repeated applications, it's possible it'll start to degrade the fibers in whatever it is that you're using for a mask.
What about gloves? A lot of people are saying that, do the gloves provide us perhaps a false sense of security? You wear these gloves, you go out to the store, you touch everything. We're not used to wearing gloves like physicians. What's your advice about the gloves?
If it's a reminder of what you're doing, I think it's helpful. It's no different. You can use your hands, touch things, and as long as you wash your hands before you go about the rest of your day and touch your face, that's just as effective as wearing a glove. But I suspect there may be some benefit just because, especially for people who aren't used to wearing them for long periods of time, it's probably a reminder that you need to be more cautious because it's easy to let that slip. So I wouldn't say I'm either strongly for or against. They're reasonable, but certainly not necessary if you're practicing good hand hygiene otherwise.
So I have a question from Monica Davis, and this relates, I think, to a lot of people about it is starting to be allergy season. And of course, some of the symptoms that you get with allergies might cross over, so people get nervous. She says, not shortness of breathing, just tightness, requiring use of an inhaler, no fever, no other symptoms. Is this likely just allergies, or do I need to be concerned?
So, of course, over the phone, that's a difficult question to answer. I think you have to go with a few things. Does this feel like your usual allergy symptoms at this time of year? If you have an inhaler, then obviously you're already on an inhaler for this, so it's not a surprise that you might need it once in a while. If you haven't used your inhaler in 5 years and now you need it and you don't feel well, that would certainly lead to a different recommendation than if, in the absence of COVID, you would think that this was just your normal allergies. So I think you have to go with, your own instincts and common sense, as long as you're not short of breath, and play it by ear a little bit and then see how things develop. It's going to be hard for everyone, I think, for the foreseeable future, not to wonder every time we get almost any symptom whether this is the beginning of a COVID illness. And that's just because we're human and we all have anxieties.
Is there a lag time with the testing? I have several questions about, what if the test comes back negative and then 5 days later you have symptoms? Like, what is the concern about this testing? Do we always get the results? Are they always accurate, or could you miss it sometimes?
Unfortunately, the short answer is you could miss it. The tests are good. They're not perfect. There's no lab test that has 100% accuracy. Some of it depends on all kinds of things about how likely it is you have it to start with, as to whether it could possibly miss it. And then there's timing issues. What we're hearing is that generally, if you have symptoms, the test should be positive if it's done properly. But again, it won't pick up 100%. So it's unfortunate, but true that there's just nothing that's perfect in the arena of testing.
What about building up your immune system? I know that that's something that we're going to be exploring later on. Dr. Oz is doing a special about zinc. We know that zinc has had some clinical efficacy against the flu. Does it hurt? Would you be taking zinc? Would you be taking elderberry syrup? Some of these things that were known to help our immunity in regular times.
I think it's hard to paint any individual medication, particularly an over-the-counter thing, as a general immune stimulant. The immune system is really, really complicated. There's people far smarter than me that study allergy and immunology and could talk about it for long periods of time. But, if you look back, there's really rarely been single individual drugs that have been proven to be miracles for any sort of general immune function. So if you're already taking those, I'm not sure I would tell you to stop, but I don't think there's any good evidence that you should start taking anything that you don't already take in the hopes that it's going to protect you. Your best way to have a good, healthy immune system is to be otherwise healthy. And that, usual stuff that everyone maybe rolls their eyes at, but diet and exercise and weight control, that's what's going to keep you healthy. And that has ramifications for all of the different systems in your body. And
sleep too, right? A lot of doctors will say
Correct.
It's a drug of choice. Getting good sleep, your body can really recharge, and your immune system is at its best when you're sleeping.
Exactly. And that's, I'm fairly certain worth more than, most of the other things we might try and look to from a pharmacy.
Now, there is the anxiety issue, and I'm getting some questions in the feed about there may be somebody who already has care and they're being treated for anxiety, but there's also people who didn't have anxiety maybe 6 weeks ago who are struggling now. Is that something they can get an appointment for, or what's the recommendation?
It is difficult, and we empathize with everybody, and certainly, a lot of healthcare workers also feel the same anxiety. I would say that certainly if we're already taking care of you, call us and we can talk about it. We don't have behavioral health specialists, but certainly a lot of the primary care doctors can handle that stuff. If it's an exacerbation of pre-existing anxiety, that's maybe a little bit easier because then you kind of know you have an established diagnosis.
Yep.
So we will either help or try to help or direct you towards another facility that can help with that if you're experiencing that.
I'm just going to throw it out there because I did an interview yesterday with Hartford Healthcare has now Institute of Living. They have really expanded their behavioral health telehealth. So if you do go to health, you'll be able to find they are taking new patients. So I'm just going to throw that out there. And CHR as well. We've been doing interviews with them that are strictly behavioral health. So that may be different than obviously calling Starling if you have something to do with your medical needs. We want to stress that you are taking new patients. That is something that if you're just joining the feed and you need a doctor, urgent cares are open. They're asking that you call. You'd like people to call first because we can determine, do you need telehealth or do you actually need to be seen at an urgent care facility? Is that right?
Correct. And for the protection of everyone, to make sure that we've screened patients and understand who's coming so that we can put people in the right location if they might have an infectious disease versus other problems.
I want to just ask you, as I know we're running toward the end of our interview here with you, but I want to ask you, there's one question coming. Could we have already had it back in January or February? People who experienced really bad, maybe bronchitis, shortness of breath, fevers, some people even saying they were very sick and tested negative for the flu. Is there an assumption that that could have been COVID back then?
It absolutely could have been. we probably won't know that for the near term. One of the other types of lab tests that some of us are eagerly awaiting is what's called serology, where they can look for antibodies. And then some of these people that had illnesses that were pretty suspicious retrospectively, we may be able to see whether they have those antibodies and are actually hopefully immune now. That'll also give us a lot more information, even if it's after the fact, about how it spread through the population and how widespread exposure really was.
So we'll see, because I know that is something that a lot of people are curious about, and that we're hearing doctors talk about with, will we be able to use plasma to perhaps treat people in the future? This might be a little bit out of the realm, but I'm just going to ask because we have some questions. People are wondering about the mail and packages. We've heard from different sources that it could live on cardboard for 24 hours, this virus. What's your advice, if any, about mail?
If you're worried about it, by all means, wipe it down before you open it and then wash your hands. Certainly, that's not thought to be the main avenue of exposure, but I can understand why people would have concerns about it. And the simple answer is, just take the appropriate precautions then and wipe it down.
And lastly, if you have been asked to self-quarantine or maybe even isolate, how are you advising your patients to do that when they're living in a family setting?
It's difficult. The DPH and the CDC have a list of pretty good instructions you can get off of their websites about it. It basically has to do with maintaining distance as much as you can. If you're in the same room with people, you want to wear a mask. Preferably, you want to have your own bedroom, your own bathroom, and clean those areas yourself rather than someone else from the rest of the house coming in and cleaning that part for you if that needs to be done. Obviously, if you're very sick, that's harder. Certainly don't share utensils, don't share, obvious things. And depending on the size of your house, obviously those can be pretty difficult hurdles for people to get over, but you do the best you can.
For the patients that you have seen that perhaps have had COVID, are you seeing a lot of people with mild symptoms, people recovering fine? I know people are curious that we talk a lot about the deaths, and we've certainly had many in Connecticut and approaching 15,000 nationwide. But are you seeing younger people get this? And how in general are you seeing people fare?
It's the whole spectrum, which is one of the really weird things about it, is that you get people that we know from other countries who definitely had it were asymptomatic. They're concerned because they can spread it potentially pretty easily, not knowing they have symptoms. We see plenty of people with very self-limited things, some of whom have been tested positive. And then we see the terrible stories of people who are in the hospital and deathly ill. So it really runs the full spectrum, which is one of the stranger things about this as a disease.
One last question, and I keep saying that, but we did get a few, so I'm going to ask it. I haven't heard of this before, but people are asking about tonic water. One person even saying their doctor said drinking a couple glasses of tonic water can help stave off the virus. Is there any science to that?
None of which I'm aware.
Okay, good. So there we go. We have answered it. And I guess, what people normally do to stay well and stay healthy, as long as you're doing it without just following random advice on the internet. I guess we want to be cautious that you're not taking these things from the internet and doing something you haven't already done. But if you're someone who usually likes to eat a lot of fruit and vegetables, take your multivitamins. No harm in that.
I would say even if you're not someone that likes to eat a lot of fruit and vegetables, do it anyway because it's good for you long term. But I think you make a great point. There's plenty of bad people who seize on opportunities like this to try and sell things and get out crazy, theories on the internet. So, like any other time in your life when you need good advice, you want to consider the source, look for consensus among people who seem trustworthy and follow that rather than being victimized because of anxieties.
Thank you, doctor. Any final thoughts that you want to leave folks with?
No, just, everyone I think already is, but take it seriously. Take every step you can, to protect yourself and your family, and we'll get through this.
All right. Thank you so much. We're speaking with Dr. Michael Posner of Starling Physicians, letting folks know that there is still help out there in this pandemic and resources available to them. Thank you so much for being with us.
Thank you for having me.